Okay, students, I'm discussing on the principles of justice now, which is obviously one of the most important ethical principles that we have. Well, all of them are important, but justice is also has something to say when we talk about its significance. Now, take note that when we talk about justice, it's the principle that governs social fairness. Kindly highlight the word or kindly write the word social fairness. Its main concern, guys, is social fairness. It determines, no, the goal of it is to determine whether someone should receive a resource or not. Halimbawa, no? Halimbawa, pag meron tayong mga flood incidents, okay, pag merong mga baha, pag merong mga bagyo, the principle which applies in determination if who will be receiving the relief goods, no, during these tragedies will be based on the concept of justice. Okay, so yung pag-distribute po ng relief goods natin is based on the principle of justice. Now, when I talk about the principle of justice, guys, what do you think apply? Is it the principle of equality or principle of equity? Pag sinabi kong justice, ano yung ginagamit natin? Prinsipyo nga ba ng equality or equity? Any idea? Sige na, hotbox. Okay? May nagsasabing equality. Maraming nagsasabing equality. How about others? Is there somebody who would agree with equity? Okay. Now, that being said, no, I can say that we have different perspectives on that. Guys, when we say equality, tulad ng sinasabi ng term equal, ibig sabihin equal yung marireceive ng lahat. Okay? Now, let's picture the distribution of relief goods. No? Let's picture the distribution of relief goods. Halimbawa, in the community, there are rich people and poor people. If I will apply the principle of equality, ibig sabihin, class, the rich people will receive 500 pesos of relief good. The poor people would also receive 500 pesos of relief goods. Ibig sabihin, the same po silang marireceive. The same silang marireceive. But if I will be applying the principle of equity, if I see that the rich people does not need it as of this time, I will prioritize giving the 500 pesos to the poor and do not give the rich people yet. Because that's the principle of equity. Okay? Pag sinabi ko po na principle of equity, ano pong ibig sabihin yan? In other terms, as much as he deserves. One gets as much as he deserves. Okay? Halimbawa, kung dito sa Iloilo, halimbawa, no, nagka-typhoon. Pagkatapos, may mga municipalities kung saan malaki yung pinsala ng bagyo. Kung saan mas malaki ang pinsala ng bagyo, doon po mas marami ang relief goods na ibibigay. Compared to those places wherein the damage of the storm is only minimal. Okay? So if you would compare it, the principle of justice is actually akin to the principle of equity. So justice, guys, is talking about equity. It is the principle that governs social fairness and determine whether someone should receive a resource or not. Eh baka sabihin nyo, sir, unfair naman yun. Mayaman kasi kami, hindi kami makaka-receive ng resources pag magkaganon. Ano? So guys, hindi naman na hindi po kayo makaka-receive ng resources, pero last po kayong priority. Because after all, what we are thinking is that everybody will get what we deserve. Okay? Yung mga mayayaman, syempre, may mga pinsala din naman sa kanilang mga ari-arian, but that damage is of course less aggravated compared to that of the poor. Okay, kindly take note of that. Now, connotes giving one of his or her due entitlement benefits, okay, on has a right. So it's giving one his or her due entitlements or benefits on has a right. So kung ano yung mga rights niya, binibigay po natin sa kanya based on the principle of justice. Now, justice means also fairness, no? Justice means fairness. In the clinical setting naman, kanina yung example ko, relief goods. Now, punta tayo sa clinical setting. Pag sinabi natin in clinical setting, as you can see, the care applied is applied equitably, fairly, justly to each individual. Halimbawa, ano? If you would notice in the hospital, especially pag private hospital, the usual ratio is 1:6. Pag sinabi kong 1:6, one nurse will be taking care of 6 patients. Now, pag pupunta akong intensive care unit, how many patients are the nurses taking care in the intensive care unit? Any idea? How many patients are being taken care of by each nurse in an intensive care unit? Yes, guys? Okay. Yes, Angelica.
1:2 or 1:1 po.
Tama. Okay. Very good. Okay, class, in an intensive care unit, you have the ratio of 1:1 to 2. Ibig sabihin, ang isang nurse would take care of 1 to 2 patients. Pag magkaganon, tingnan nyo, bakit naman sir dito, 6 na pasyente, sa kanya, 2 pasyente lang? Guys, because the patients in the ICU have high acuity. Pag sinabi kong high acuity, alam yung kadalasan naririnig nyo, uy, toxic. Okay? Toxic uri ng mga pasyente dyan. In other words, class, the patient in the ICU actually has high demands. The patient in the ICU class has high demands. They also have high physiologic needs. So hindi ko pwedeng sabihin na, okay, 6 na pasyente din dyan sa ICU. Kasi nga doon sa ward, 6 din na patient yung tinitake care namin eh. The purpose of having your patients in the ICU is that they will be closely monitored. And for that reason, class, the ratio and proportion is 1:2. If you would look at it, it is the principle of equity that is being applied. So hindi siya equality, no? Hindi siya equality, but it's equity. Now, fairly. Pag sinabi nating fairly, so pag sinabi kong fair, halimbawa, pag titingnan po natin yung distribution ng nurses sa isang hospital, may 3 rotation po yung karamihang hospital natin dito sa Pilipinas. Pag sinabi kong 3 rotation, palagay ninyo, saang rotation mas maraming nurse na nagjo-duty? Umaga, hapon, or night? Palagay nyo lang, hulaan ninyo kung hindi nyo alam. Palagay nyo, saan mas maraming nagjo-duty? Aba, night. Okay, morning sabi ng iba. Okay, umaga. Okay, class, kadalasan marami pong nagjo-duty kapag umaga. Okay, marami pong nagjo-duty kapag umaga. Kadalasan nga po parang 40% ng staff ng dyan. Pagkagabi po, parang pag PM po, 20%. Pag umaga, 60% po pala. Pag umaga, it's playing at 50. Okay, let's say 50%. The usual is that 50% is on duty. Pagkahapon, 30%. Pagka-night po, 20%. Other hospitals are saying they have 40, 20%. Now, kung titingnan nyo, sir, bakit marami kung umaga? Kasi nga, mas maraming procedure ang nangyayari kapag umaga. Mas marami ang ginagawa ng mga pasyente kung umaga compared mo sa mga patient during night at saka afternoon. So for that reason, class, if you will apply the fair distribution of the staff nurses, your staff nurses in the AM shift are more concentrated compared your afternoon and your night shift. Okay? That's one application, and justly to each individual. Now, nurses cannot play favorites or compromise care because of personal opinions or beliefs. Halimbawa, if you are taking care of 6 patients from room 201 to room 206, halimbawa, tapos it so happened na si room 201 maganda. Hindi pwede that porket that patient is beautiful, you will be visiting that patient more frequently than others. Okay? Not because that patient is kind, you will be giving more attention to that patient compared to others. Dapat you should give attention to all of these patients the way that they deserve the attention. Okay? Ganon, ha? That's how it applies, no? Pagkatapos, halimbawa, your room 202 is your family member. It's not possible that you will just concentrate taking care of your family member and neglect the other patients that you have. In fact, if you are the nurse, guys, and your patient is admitted in the unit where you are working, it would be wise for you to have the patient transferred to another nurse rather than for you to take care of your own family members, because there are always ethical risks if you are taking care of your own family members. Mahirap po i-separate ang work tsaka sa personal life. So it's better for you not to take care of your family members in the hospital setting, rather than take care of them. Tapos nagiging bias ka when it comes to your other patients. So that's one application of the principle of justice. Now, when I talk about justice, there are usually 2 types. No? Okay, 2 types, sinasabi nila. One is your procedural justice, the other one is your distributive justice. The 2 types of justice is, one is your procedural justice, and then another one is your distributive justice. Now, let's talk about your procedural justice. Pag sinabi kong procedural justice, you have what you refer to as the due process of law. Okay? May tinatawag po tayong due process of law. Halimbawa, kapag nagkasala si John, for example, nagkasala si John sa unit ko, I could not tell John, hey John, you cannot report on duty by tomorrow. You are suspended. I cannot do that because before I can suspend John, there is due process of law. And what does the due process tell us? That there should be first warning. Okay, in fact, there should be first warning, second warning, up to third warning. After that, if John is still not obeying by the rules, there could be suspension. And after that, there could be dismissal. If I found out that John is not following the rules and regulations of the hospital. Okay? Now, other than that, before John can actually be suspended or before John can actually be dismissed from the hospital, where I am, for example, the head nurse, there needs to be hearing. There needs to be hearing. Now, the two components of due process. In law, the two components of due process are notice and hearing. Again, the two components of due process are notice and hearing. So what does it mean? For example, if I don't like the performance of John, I need to let John know. And then I will let John know, hey John, I have a complaint against you. That's making him noticed. And then, my human resource department could not decide, okay, let's dismiss John. Hindi pwedeng ganon. Ha? Malilabor tayo niyan. No? We will go to labor. And what would we do then? We need to hear the side of John. Okay, we need to hear the side of John before we could proceed to the next steps. That's what you refer to as procedural justice. Okay, that's what we refer to as procedural justice. In other words, not because somebody has made a mistake or has made a mistake right away, they are guilty. There is what you refer to as procedural justice. Now, it also says that when you get your turn, you receive the same treatment as everyone else. That's part of procedural justice. Now, let's talk about the another type, which is your distributive justice. Pag sinabi kong distributive justice, this relates on determining what is fair when decision makers are determining how to divide burdens and benefits. Now look at the keyword, divide burdens and benefits. That is why it is being referred to as distributive justice. So halimbawa guys, now why is it called distributive justice? Because the goal is to distribute. Okay, the goal guys is to distribute. But look at the distribution. The distribution, my dear students, will not be only focused on the burden, but it will also be focused on the benefits. Halimbawa, if you have committed some error in the operating room, kaya halimbawa, there was an error committed in the operating room. Let's say, for example, that the sponge, are you familiar guys with the gauze? Are you already familiar with the gauze? Yung tinatawag nating gauze, familiar tayo? Others, hindi ko nakikita yung expression. Familiar naman tayo. Okay. Guys, let's say for example, that during the OR, a sponge was left inside the patient. Pag sinabi kong sponge, isipin nyo lang parang gauze siya. Medyo malaking uri lang siya ng gauze. Pagkatapos guys, naiwan siya sa loob ng patient. Let's say for example, the patient went back to the hospital after 2 weeks. After 2 weeks pagkatapos, nalaman na yung pasyente may infection na. And when an ultrasound was done, it was found that there is a foreign body. And the foreign body inside the abdominal cavity is a sponge. Okay? Who will be held liable for that? Name people who will be held liable for that. Sige na. Okay? On chat. Name people who will be held liable for that. Sino po yung mga tao? Sige. In a while, ha? Okay? Surgeon, very good. May nagsasabing scrub nurse, very good for saying the whole thing. Okay? So let's apply that. Okay? Sabi ninyo, okay, marami kayong sinasabi and mostly nang nabasa ko, tama. Surgeon, tama. Head nurse, tama. Assisting nurse, tama. Whole team, tama. Okay, class, let's apply the principle of distributive justice. If I will apply that, kung ako po yung surgeon, okay, Halimbawa, may surgeon. Tapos guys, may anesthesiologist pa yan ha. May anesthesiologist yang kasama. Tapos among the nurses students, you have your scrub nurse at saka you have your circulating nurse. Okay? Let's say for example, ito lang munang 4 kataong tong kausap natin. Palagay nyo, when it comes to distributive justice, sino yung may mas malaking kasalanan sa kanilang 4? Sino ang may mas malaking kasalanan sa kanilang 4? Sige na, I want to see the chats moving. Who would have a greater mistake among the 4? Okay? Nurse, surgeon. Okay? I want to hear Bianca. Bianca, why did you say surgeon? Nasaan si Bianca?
Hello po,
Here.
sir.
Yes, why
Hello
surgeon?
po. Hula ko lang po. Kasi po siya yung parang pinaka nagli-lead po doon.
Tama.
Pag may...
Okay? That's the reason. Because the surgeon is actually the leader of the group. Others would actually refer to the surgeon as the captain of the ship. So dapat, before the surgeon closed the abdomen of the patient, he should have checked what it inside the abdomen of the patient. Okay? That's it, no? That's it. That's how we apply distributive justice. Sir, paano si anesthesiologist, scrub nurse, circulating nurse? They will have their own share, but the greater share of mistake will be that of the surgeon. Okay, the greater share of mistake will be of the surgeon. Now, fair, equitable, and appropriate distribution or allocation of responsibilities or share also of the rights and terms. Almost the same message lang naman siya na sa nakasulat sa taas. So class, the main point is that in distributive justice, we distribute the burden, we also distribute the benefit. Okay, we distribute the burden and we also distribute the benefits. Okay, so kindly take note of that. Ha? Ganon yan guys, ganon yan. Now, let's go to the next slide. So let's talk about the principle of beneficence. Pag sinabi kong class principle of beneficence, okay, give me 2 words. Give me 2 words that would describe the principle of beneficence. Thank you, Sheila, for saying do good. Okay, thank you, Sheila, for saying do good. Okay, anyway, may na-notice pa akong question. Sir, does it apply in kasalanan ng isa, kasalanan ng lahat? Well, that applies when it comes to surgery. That applies, guys, when it comes to surgery. Kasi, guys, in surgery, okay, beneficence, maiwan ka muna. Okay, class in surgery, there is what we refer to as shared accountability. Okay, meron po tayong accountability. Halimbawa, the surgeon is considered to be the team leader of the surgical team. Now, how about the scrub nurse? Pag sinabi ko pong scrub nurse, siya po yung nag-hand ng instruments kay doctor. Siya po yung nag-hand ng instruments kay surgeon. So si scrub nurse po sterile din. It is the responsibility of the scrub nurse to ensure also that there are no sponges or no foreign objects left inside the patient because she is there in the sterile field. Isa na namang responsibility ng circulating nurse. The circulating nurse supposedly is the one also that would assist on the sponge count. So pag sinabing sponge count, guys, halimbawa, pagka-start ng surgery, may 10 sponges tayo. Bibilangin talaga yan. 1, 2, 3, 4. Hinahawakan namin yan plus isa-isa. No? Naka-glove yung isa, sasabihin 1, okay? 2, 3. Isa-isa talagang bibilangin yan. Pagkatapos, once for example na may dugo na ng pasyente, idadrop yan sa bucket, hindi po pwede na yung 5 pieces ika-clamp mo tapos itatapon sa bucket. Isa-isa din po silang dinadrop. Kasi by the time that the patient would be closed, no? Limbawa, maraming layers yung abdomen nyo eh. You will learn that in EPCAS. By the time that the patient is closed, you should have your first count. Okay? Bibilangin. Sabi kanina, 10 yung sponges natin. Nasaan yung 10? Sasabihin ng circulating nurse, 1, 2, 3, 4, 5. 5 on the table. Tapos yung 5, hahanapin. Saan napunta yung 5? Ang 5 dapat nandun sa bucket. So bibilangin naman, 1, 2, 3, 4. Pag 4 lang yung sa bucket, mag-pause muna. And then you need to look for another one which is gone. That's how strict it is supposed to be in the OR. So in the case that we've talked about earlier, kasi may isang sponge na natira. So may shared accountability sila kasi responsibility ng surgeon, responsibility ng scrub nurse at circulating nurse na hanapin yon. So pag kulang yon at nandoon pala sa loob ng pasyente, how come that it's there? How come that it's there? Okay? Plus tawag niyan sa law, okay? Tawag niyan guys in legal terms is res ipsa loquitur. When I talk about res ipsa loquitur, it says the thing speaks for itself. The thing speaks for itself. Halimbawa, kadalasan kasi magkakatanungan pa, sinong may kasalanan? Plus in this case, the thing speaks for itself. Obvious naman eh. Alangan naman yung pasyente, yung maglalagay ng gauze, di ba, sa loob niya. Okay, so the thing speaks for itself. It's very obvious that the surgical team will be held liable. Okay? So, sa tanong ni Andre, it would actually depend on the situation. Halimbawa, kapag sa clinical setting naman tayo, ang pasyente ni Nurse A namatay kasi si Nurse A nagdi-date during duty hours. Si Nurse A kasabay at si Nurse B nagjo-duty. Wala pong liability si Nurse B. As long as hindi alam ni Nurse B na nagdi-date si Nurse A. Pero pag alam ni Nurse B na nagdi-date si Nurse A at saka wala siyang ginawa, Nurse B is also held liable. Or kapag sinabi ni Nurse A, Nurse B, alis muna ako, maglalab-lab muna ako, ikaw muna bahala sa pasyente ko. Tapos sinabi ni Nurse B, sige Nurse A, enjoy love life. The responsibility is transferred to Nurse B. So it will be Nurse B also that will be held liable. Okay? So hindi po siya kasalanan ng isa, kasalanan ng lahat in all cases. It would depend actually on the accountability that happened. Okay, Andre, does that answer your question?
Yes po, sir.
Okay, sige. Now, beneficence. Punta tayo kay beneficence. Beneficence means doing good. Okay? Kung kaya nga class, may tinatawag tayong benigno, di ba? Pag sinabi nating benigno, tulad ng pangalan ng dating presidenteng Aquino. So class, benigno actually means good. No? Okay, the opposite of that is maligno. And you know that in Filipino, we associate maligno with something bad. So benigno means good. So beneficence is actually from the same origin that of benigno. So plus bene, which means well or good. Okay? Beneficence refers to the action done for the good of others. Again, the focus is the good of others. Now, when I talk about the good of others, this is associated with the acts of mercy, kindness, and charity. Okay? So pagiging mabait, pagiging matulungin, charitable, those are all related to beneficence. Other than that class, humanity, altruism, and love are also considered to be forms of beneficence. Okay? Diba class, when I say altruism, give me one word that could be synonymous to altruism. Something that starts with S. Okay, very good. Selfless. Okay? So class, pag sinabi kong altruism, it talks about being selfless. It's a selfless act. In fact, nursing is seen to be an altruistic profession. Okay? Nursing class is seen to be an altruistic profession. Bakit daw yung nurse kasi mag-care sa iba kahit na hindi niya maalagaan yung sarili niya? Okay? That's the idea about nursing. Now, so these are considered to be forms of beneficence, humanity, altruism, and love. Now, let's see. Plus, when I talk about benevolence, your benevolence is a character, trait, or virtue of being inclined to do good and act for the benefits of others. So, di ba pag sinabi natin, uy, person A is benevolent, meaning that person class would want to do good or act also for the benefit of others. In other words, kapakanan ng iba yung inuuna niya. It is the right of the others that he is looking into. That's how you can refer to an individual as benevolent. Now, when I talk about beneficence and higher moral burden, sinasabi po kasi that beneficence actually gives us higher moral burden. How is that so? That beneficence is giving us higher moral burden? Because of beneficence, you are morally obligated to take positive and direct steps to help others. Okay? Sinasabi po kasi ng beneficence that we need to help others. Sinasabi po kasi ng beneficence that we need to do good with others. We must not be contented by saying, okay, hindi naman siya nasaktan. Beneficence is not about hindi siya nasaktan because that is non-maleficence. Beneficence is about that let's do good to that patient. Dapat let's just do something noble to that patient. That's the goal of your beneficence. So nung sabi, no, sabi nga dyan, there is higher moral burden daw on the part. Now, your beneficence is considered to be a fundamental principle of healthcare. It is the motivation for most people who want to be in the healthcare profession, and that is helping. Okay? The motivation for people to be in the healthcare profession is actually helping others. Okay? Kaya kung kayo guys, if you were not yet able to realize and you still say that I will take nursing because I want to be mayaman, I took nursing because I want to be rich. Okay? Gisingin nyo na po yung sarili nyo ha. Gisingin nyo na po yung sarili. You might get rich in nursing, but usually the motivation that we have is that we want to help other people. Okay? That's the main word there. And that is akin or congruent to the principle of beneficence. Okay? Now, examples of beneficence in the clinical setting. 1, resuscitating a victim of drowning. Okay? So halimbawa, may drowning victim ka, tinutulungan mo siya, niresuscitate mo siya, pinaalis mo siya from the body of water, from the water, tapos niresuscitate siya. Another, you provide pain medications as soon as possible to a patient injured in the emergency room. Okay, ibig sabihin, ayaw mo that the patient will feel pain. Also, you lift the side rails on a patient's hospital bed to prevent falls. These are simple examples of doing beneficence in the clinical setting. By the way, guys, I recalled in number 1, the basic premise here is that please do not help the patient if you do not know how to swim. Okay? Help only the patient if you know how to swim. Pag hindi po tayo marunong malumangoy, huwag niyo pong sagipin or else dalawa na po kayo yung naging pasyente. Okay? Are you getting my point there? So do not help guys if ever that you are not capable of helping also the patient. Now, other examples also of beneficence in the clinical setting. So you have their practicing proper hand washing to prevent the spread of infection. Now, if you would look at hand washing now, we are taught that hand washing is the number 1 way to prevent the spread of infection. But nobody will actually be able to see you if you're hand washing every time that it is supposed to be. So it is an act of beneficence that you need to remember that you want to protect your patient from infection. So kahit may walang nakatingin sa'yo, paglipat mo from one room to another, you should hand wash. Pag transfer mo from room 2 to room 3, dapat mag-hand wash. Okay? Because you don't want the infection to be spread among your patients. Now, you're also feeding elderly people because you would want to provide adequate nutrition for these patients. And you know that once nutrition will not be provided for these patients, they might die because our body needs nutrition. Okay? Kindly take note of that. And then, providing psychosocial support to the anxious patient. Okay? Guys, ano nga ba gagawin natin sa anxious patients? If they are anxious, we just tell them, Ma'am, I'm here for you. Ma'am, if you want to talk, I'm here for you. Okay? Pero guys, we do not force them to talk if they are not yet ready. That's one premise that we have. But then we always make the patient understand that we are there for them in case they have questions. We also make the patient understand that we are there ready anytime that they will be talking about their concerns. Okay? That's one of the things that will be done in nursing beneficence. Now, the next principle there is non-maleficence. So class, non-maleficence is basically do no harm. When I talk about non-maleficence, it says do no harm. In other words, wag saktan yung pasyente. Now class, you must not supposed to do harm to your patient, whether that's intentional or unintentional. Eh sir, paano natin maiiwasan yung unintentional harm? That's the reason why you are learning the nursing procedures that we have. That's the reason why you are learning the nursing procedures that we have. What do we mean by that? When you know the nursing procedures guide, you will be able to anticipate if what are the risks that needs to be avoided when you are dealing with your patients. Okay, that's one thing. Next, there is no actually debate whether we want to avoid harm to our patients, staff, or the community. Obviously, if nasa matinukang pag-iisip, you would want to avoid harm. But then the question starts to arise when somebody will ask you what is the definition of harm. There are different definitions of harm. To a consequentialist, harm would mean prevent. You look at it, it means prevent the good or leads to less good or utility than other choices. Pero yung natural law, sabi naman ng natural law, it is opposed to our rational. It is also opposed to our rational and rational natures that circumscribe or limit our potential. Whereas for a deontologist, okay, kung maalala nyo on the theories that we have learned, what's the one word that would describe deontology? What's more important to a deontologist? Sige na, what's more important to a deontologist? Is it the means or the end? Okay? What's more important to a deontologist? Okay? According to the deontologist, you have the duty to do good. Okay? You have the duty to do good. So a deontologist is more actually focused on the means. No? So you have your duty to do good. So kung titingnan nyo class, there are differences. No? There are differences as to how harm is being defined by different people. Okay, there are actually differences as to how harm is identified by different people. Look at the virtue ethicist. The virtue ethicist would say harm is which is immoderate that leads us away from manifesting our ends as humans. Pag sinabi ko namang ethical egoist, di ba? Egoist. Pag sinabi kong egoist, it means that harm as that which was opposed to his or her self-interest. Ego kasi inuuna niya yung sarili niya. Okay? Inuuna niya yung sarili niya. Okay? So kaya para sa kanya, kapag masasaktan siya or kapag his or her self-interest is not being advanced, that individual would be harmed. No? Ganun yung definition niya ng harm. Now, in the clinical setting, harm is any condition that would worsen the patient's condition. Harm is anything that would worsen the patient's condition. And that is easier said than that. That is easier said than that. Bakit? Halimbawa, tingnan niyo yung pag-insert ng IV. Mismong pag-insert ng spero, say that this okay, am I clearly audible now? Please acknowledge. Guys, am I clearly audible now? O ipa-acknowledge if I na nag-unstable na yung internet ko. Narinig niyo?
Putol-putol pa rin po.
So for that reason, guys, now, when I talk about harm in the clinical setting, it's not actually established what is harm, no? Because sometimes as nurses, we need to ensure that when we're doing the procedure, the benefits would outweigh the harm. Okay? Ganun yung iniisip natin. Pero not all the time we can avoid the harm to our patients. Okay? Not all the time we can avoid the harm to our patient. Kindly take note of that. That's why it makes it complex in our setting. Examples of non-maleficence in the clinical setting. How can we do it? If there is an incompetent healthcare practitioner who is taking care of patients, the nurse reports the patient. Or the nurse, reports the abuse to protect the patient. What do we mean by that? For example, if nurse A and nurse B are on duty, and the nurse A was found to be alcoholic, what should nurse B do? Could nurse B do just let nurse A go on duty? Or dapat bang i-report si nurse A? If I will apply non-maleficence, let nurse A, alcoholic, go on duty or report nurse A? What do you think is best? Okay, dapat po siya nating i-report. Now, another, report victims of child abuse to social welfare for further victimization. Okay, we do not just say na, sige, hayaan mo lang, pamilya naman nila yan. No, that's not how we manage as nurses. We need to report them to the government authority. And the government authority for that is your DSWD, your Department of Social Work. No? So that is the best department that could be approached. Now, we do not also participate in euthanasia. Okay? Ano nga ba? What's the two words to describe euthanasia? What's the two words to describe euthanasia? Okay, very good. Mercy killing. We do not participate in mercy killing. Then we also do not administer drugs that are not approved by the FDA. Alam niyo yung mga advertisement ng mga herbal capsule, tapos sinasabing no approved therapeutic claims, we are not supposed to administer that to our patients. If we are administering that to our patients, we are just giving them drugs whom we do not know if they will be beneficial or not. Okay? Then we do not say hurtful words to other persons, such as the patient, the family, and the co-workers, and we avoid deliberate harm or risk of harm that occurs during the performance of nursing. Okay? So hindi po natin pwedeng sabihan yung pasyente, sir, ang bobo niyo po kasi, ma'am, nako, napakabait. Understand what they are going through. Okay, we need to understand what they are going through. Okay, I will leave the other ethical principles on our next meeting or our next week.